Hello everyone. So in this video we are going to talk about introduction to psychiatry, some common terms that are used as well as the historical events. Starting with what actually is mental health. So this is most acceptable concept now that we are going to discuss that a mentally healthy person is able to cope and function in the stressful condition. He meets the responsibilities and expresses balanced attitude towards everyone. Now we will start by understanding some basic terminologies used in psychiatry. The first one is delusion. Now the three basic terms you should know about delusion is it is false, it is firm, that is unshakable, and it is a false belief. So a false, unshakable, firm belief is what is known as delusion. And the reason for delusion is an internal morbid process. Another term you need to know is hallucination. Hallucination is defined as perception without a stimuli or perception without an object. Talking about illusion, illusion is misinterpretation of stimuli. Means consider a stimuli that is a light stimuli and patient is perceiving an auditory perception. This is what is illusion. So now let's talk about some types of delusion. Talking about delusion of persecution. Here people or the person believes that someone is trying to conspire or trying to kill him. Delusion of infidelity. Here person believes that or he's convinced that his spouse is cheating him. Talking about delusion of love or erotomania. Here person is convinced that some other person even when he has not met him is in love with him or her. Delusion of grandeur is something where a person or the patient considers himself king or superior to everyone. Okay, he is convinced that he is the president of India, something like that. Delusion of nihilism or nihilistic is a person who denies the existence of his her body, mind, or world around him. Talking about types of hallucination, we already discussed that hallucination is perception without stimulus. We have five sense organs that are spatial sensory organs for perception, and hence we have five types of common hallucinations that we see. The first one, that is most common generally, is auditory hallucination. Now, these can be elementary, that is, patient hearing his own voice, secondary, which can be commanding or commentary, and third person hallucination, where person uh, claims that he is hearing conversation between two peoples. Visual hallucinations are another type of hallucination. Olfactory hallucination, where patient claims of smelling something when there is nothing around. Gustatory hallucination and tactile hallucination, that is touch. This is more commonly seen in cocaine abuse and also known as cocaine bug or cocaine psychosis. Talking about some more terminologies, we will try to understand what actually is emotion. So, emotion is an stirred up physiological state. Okay, it is a response to any event. Trying to understand mood is actually pervasive and it is a sustained emotion that colors the person's perception of the world. Consider mood like a climate. Okay, it is pervasive and sustained, whereas when we talk about affect, that is affect. Okay, so affect is like a weather, that is mood at a particular cross section of time. Euthymia is normal range of mood. There is absence of depression or elevated mood, that is mania. Elevated mood is a mood that is more cheerful than normal but not necessarily pathological. Ecstasy is again intense sense of rapture or blissfulness. Talking about some phenomena, that is thought insertion, withdrawal or broadcasting. Thought insertion is when person feels that thought is being inserted from outside. Withdrawal is like the thought is being removed from his mind. And broadcasting is everyone is thinking along with him or listening what he is trying to think. These are the three phenomena, that is three thought phenomena that are the first rank symptoms in the case of schizophrenia. We have three made phenomena that are first rank symptoms in schizophrenia. These are the made feelings, made impulses, or made acts. Here patient uh, experiences that feelings, impulses, or actions are not his own, or he is being imposed to do that. Talking about obsession, we need to remember that obsession cannot be eliminated from consciousness. It is a thought that cannot be eliminated from consciousness. It is involuntary, ego dystonic, recurrent, and irrational. Compulsion is when motor acts are included in obsession. Talking about fear and some more terminologies, these all affect that is the cross sectional area of our mood, that is our mood at current situation or right now. Fear is an unpleasant affective state that is a response to a realistic threat. Mind you, there is a realistic threat. Talking about phobia is a persistent pathological unrealistic intense fear, but there is actually, it is pathological and unrealistic. These are the 2 points which you should remember. Talking about anxiety, this is also an unpleasant affective state. Our affect is being involved. This is because we have expectation but not certainty of something untoward that is going to happen. Panic, we should remember that panic involves autonomic arousal symptoms and it is an acute, intense, overwhelming attack accompanied by feelings of. Talking about deja vu is an over familiarity of a place or an event. Okay, so the patient sometimes comes with a deja vu that he is having over familiarity to the clinic where he has never visited before. Jamaya's view is less familiarity with the place or event which already has occurred and person was knowing it. Confabulation is falsification of memory, and insight is one's ability to understand one's surrounding as well as external situation. Importance of insight is it is absent in a psychotic disorder. Means a patient with psychotic disorder won't visit you with a complaint that he's having some disease, contrary to a neurotic patient where the patient has an insight and voluntary visits to the clinic for the diagnosis and disease treatment. Brief about the biopsychosocial approach to mental health. This triad explains that there are many factors that multifactorial a psychotic disease can be. These involve biological factors that are family history, history of brain structure or chemistry, the genes involved, chromosomal anomalies. Psychological factors include the stress, the guilt, helplessness, and other factors. And social factors are role, expectation of the persons, and the normality and the disorder that he may have. Talking about some historical events in psychiatry, these are actually interesting facts that I would like to share. It was 5th century when mental disorders were considered supernatural in origin, and religious leaders often turned themselves into an exorcism to treat this mental disorder. It was actually Baghdad, Fez, Cairo, and Bethlehem Royal Hospital in London which first it was first, okay, in medieval Europe to treat mental disorder. But actually, this treatment was only a custodial care. There was no medication or nothing. But it was better because it was in custodial care. Talking about some more of the history, it was talking about the Enlightenment age. Okay, it was around 1620 to 1780 when it was attitude of the people started changing towards the mentally ill. It became more of a compassionate approach for treatment. The pioneer in this was Pinel and Tuke, more of Pinel. Okay, Philip Pinel is who started the moral treatment for mentally ill person. Pinel allowed patients to move freely around the hospital grounds, and eventually dark dungeons were replaced with sunny, well-ventilated room. Okay, so he was someone, he was pioneer. Okay, he brought many changes in the field of psychiatry in the benefit of the patients being more compassionate with them. So, finally, understanding the treatment of psychopathologies and who can help with them. A psychiatrist is one who has done MBBS and MD with a specialized training in mental disorder. A clinical psychologist is a PhD, okay, and some of the all therapies except drug intervention are what they are involved in. These are the two main terminologies and others. Thanks for watching.